In the United States, it was the Native American Navajo tribe that was hardest hit during the COVID-19 pandemic. Navajo Nation is the second largest indigenous reservation in the United States. It spans Utah, Arizona, and New Mexico, and many areas don't have running water or electricity. I spoke to Alicia Martin, a chef by training and a community organizer fueled by a passion to help those in need in her community.
It was difficult, like almost every day, to try to just like deal with the death. I had a post about the numbers because I felt like people weren't seeing the numbers. So they're like, okay, we lost some people. But then I was like, no, look, we lost 14 people. And the next week we lost 29. That's double. Seeing the numbers was extremely difficult. It was hard to, look up the numbers and at the same time see all the GoFundMes that were popping up for the people that passed away.
That was, I think, one of the most bothersome things, that the COVID infection rate was highest amongst the Navajo Nation, surpassing that of New York State. I did not catch the headlines as it should have, why wasn't the Navajo Nation being designated an epicenter? What type of work are you doing, currently, and how did that start?
I think I was away from my family for maybe 5-6 years. So then I was just craving that. See, we got situated here. I started working at a restaurant because I am a chef. I went to culinary school. I left that resort for another restaurant that was opening. And my concept was, we research pre-colonial foods. We research what is truly Navajo, because a lot of people don't know. And I want to preserve that knowledge before it disappeared, because a lot of culture is around food. I knew our elderly and the people that knew it they don't have much time left. I felt like I was gone for a few years and now I'm racing against the clock to learn what I could. So that's what I was doing the last couple months. And then COVID hit. And then my grandmother, she actually passed away in December. So that was,
sorry to hear that.
I don't know if it was like a tough thing. It was just more like reality. They are getting old. They're going to leave. She was very strong and defiant. She was a protester too. She was always at protests. She was always very political, and she didn't care to be a politician. I think she cared about doing what was right for people. My grandmother before her was the same way. My dad's great grandmother, they were all the same way. It has to be for the people. So even the Navajo Nation president, Jonathan Nez, showed up to her funeral. Like we weren't expecting it. We just knew her as our grandmother, but the people, when they spoke up about what she did for the community and how she helped them, how much she cared for other people, it was just super inspiring.
Wow.
Yeah, even the Navajo Nation president's like, yeah, she would get after me if I was going for the wrong policy, and she'd be yelling at me. So I was like, okay.
Keeping him in check and keeping things in check.
Yeah. You know how grandmothers do that, and being inspired by her legacy. So even as, a manager, I'm going to have staff. I'm going to have people. I got to care for them. I got to care for their families. She instilled that, and that just re-energized, I guess, or just woke that side of me up. I don't know. I think some of the decisions, if it didn't benefit the people or my staff, I would always say something. I think I was very frustrating one, because I said, no, you take care of your people, they take care of your business. That's good business. If you don't take care of your people, then you're doing something wrong. And so I think looking back now, I realize I'm better as a community organizer than like trying to do that in a restaurant. So Navajo Nation shut down tourism, which shut down the canyon, which the company decided to lay everyone off. Like just immediately you're laid off. And I was just kind of like, I feel like there's a better way. They could have cared for the people they were a multi-million-dollar company. They had a lot of money. Second week of March, they just laid off like everybody they didn't need to. And at that time, everyone was going crazy buying everything. Paige is in a remote location, so it takes a while to get things here. I was down in Phoenix when things were getting shut down, and that's when me and my two sous chefs started buying what we could in Phoenix. I knew at the time that I was very lucky because I had a savings, so I had money to buy things, and I didn't have to care about the price. And I know that a lot of Navajo people, they don't have a savings, and they're very careful of the price. So if all the low expensive stuff is gone, then they're not gonna, it's a lot harder struggle for them. So when I got back up here, of course, there's no toilet paper, there was no potatoes, there was no meat, there was no flour, there's no baking powder. Navajos make their own bread. That's just something like you have to know how to make bread. So it was the flour and baking powder that was gone. Knowing that we had just opened an account with one of our purveyors for the restaurant. So, I can't make a company buy things, but I said, can I purchase a couple things through our purveyors and then sell it, and then I'll give you guys back the money. That's what started the company's community sales, I guess, where we bought ground beef, potatoes, eggs, and flour. That way, I could at least provide that to the community so they could have potatoes and things like that. I wish I had the money to give it to them for free, but I am a single parent, but that was the best I could do.
Right, but that's amazing that you could do that, and that was coming out of your sort of blossoming chef career, and how that tied into what began to happen with the pandemic.
Yeah. So, and then I was concerned about elderly with their money. So people could buy a food box for an elderly. So they would give us $30, and if an elderly came through, we would give them a food box for free because somebody else would pay for it. So that way, I was also able to, give it to those who were struggling, because it wasn't the easiest thing to see, like, this elderly Navajo man who had like $12, who's trying to decide what to get, and then it's like, don't worry about it, it's already paid for, here's your box, and they're like, really, like they're kind of emotional. And then that's when you realize how scared they probably were, that they didn't realize they were afraid. They didn't realize they were that worried, So, they come with what we're just gonna get what we can, but then the relief that, it's a good thing, but at the same time, it's a hard thing to realize that people are in need that, that bad. So we did that twice. But then, I was very concerned about safety. So we stopped the food sales. And also the other thing was we would continue it if it was a need. But after a while, the stores, they started to have potatoes and things started to come back. So we only did that for a small period of time, just when it was a need. My parents had spent some of their money to buy things for people in Gap. My parents have always been involved in Gap, with the roundups. They just know everyone. So they bought things. When my dad worked at the power plant, if he saw a truck that was for sale for $1,000, like, he would buy it because it was good, it was working, it was running. He used to have a van, so he's been in there forever. So if there was a family that needed a vehicle, he's like, here's my van, here, you can take it, it's paid off. Or I'd come back, he's like, oh, I gave the truck away to those guys because they didn't have a way to haul water. So he was always doing things like that because he worked at the plant, he made a lot of money, but he was okay. So anything extra always went back to the community. So my parents had bought some stuff, and I had some stuff left over from our last food sale. So we got some food boxes together, and we went out there. It was probably 2 weeks after everything shut down. across the nation. So this is just 2 weeks after we went out there. We gave out, food boxes and stuff, and people were grateful. And then we were hearing from people, you guys are the first people to come out here. It was extremely concerning, It was like 2 weeks after. I didn't realize no one was helping you guys. The Navajo Nation shut down the chapters. So that's like you shutting down city council during an emergency. Like, no, it's shut down. You guys, it's like, that doesn't work,
Right. You're leaving people, on their own in an emergency situation.
Mm-hmm. And that's what happened throughout the beginning. The chapter houses were shut down. People would come through our line to buy food, and they said, we can't get a hold of our chapter president. We can't get a hold of anyone for any help. I think a lot of them they were scared of the pandemic, and they didn't have any emergency plan. Just a lot not getting done at the chapter. And I think the people that would hold them accountable would, just move somewhere else, So a lot of those issues that were major back then, became a real, there were major issues back then, but, now it's like,
they were just, they just multiplied and just accentuated.
Yeah, and of course the chapter presidents, before they're like, they thought, I can't get in trouble, or I'm just doing. They could be lazy back then.
Yeah, and I think that's sort of been the common theme where, all of the gaps and all of the holes in our systems and in our communities really came to the forefront during this pandemic. Right, it really exposed a lot. Yeah. With the water scarcity that is already present, in the community. Mm-hmm. So how challenging was that, like for people, because you don't have running water, you don't have enough water, they're trying to conserve the water as it is. But in this time, this pandemic, you need to be, washing your hands. How challenging was that?
There was a lot of challenges. I think there's multiple challenges. One is like people will wash their hand in a bowl. So they're not thinking about all the germs when they're sharing a bowl, possibly. Another thing that in Gap is just where the store is, and Botterway is kind of like surrounding areas. So Gap Trading Post and a Gap store, they only have a gas station and a small grocery store. That's it. But it's the main highway goes through there, so the tourists stop there. The gas station, you weren't allowed to use the bathrooms. They closed their bathrooms down. And for me, that was frustrating because I was like, if people go to the bathroom, they're going to wash their hands.
Yeah, right.
You're eliminating the hand washing. And now people and one of the issues, especially up here, is the tourists. The tourists come in, they could bring it in, and they're mingling with the locals where the locals need to shop. It's the main highway. You need a hand washing station. You should require mask and hand washing before entering. I don't know how many families wash their hands out there. I do know that usually it's a shared bowl. And also when they get water to their house, they have a huge drum of water. So they put a hose in there and they have to suck the water out until it runs out, and then they fill it. So they're putting on their mouth and they're filling up buckets.
Really?
And then they carry that bucket inside to go clean, cook, or what they need to.
Oh boy, yeah.
So I don't know if you've ever seen anybody, like, you have to suck the water out, and that's just, before it wasn't deadly.
Right.
But now it's like, so now, we're trying to raise money so to buy, these pumps with a siphon so they could use that and the water comes out and they're not putting their mouth on it.
Yeah.
But so there's a lot of reasons like that, how it spread. If it's the drinking water, it's in a bucket and you put your cup in there and someone else puts their cup in there, and
contamination going on, cross-contamination that way.
The elderly not understanding English, not having Facebook, they don't have electricity for the news. I believe, the game where you whisper in someone's ear and the message changes.
Like a telephone, essentially.
Yeah, so by the time it gets to them in Navajo, all they hear is, there's a sickness, and they thought it was like the flu.
Yeah. Well, that wasn't just the Navajo Nation. People living in big cities are still thinking that. So even with the news and even with all of the resources right in front of them.
Yeah, well, the Navajo Nation, they don't have a lot of modern words for things.
Okay.
So you have to use description words to explain to them what's going on. And it's difficult for them to understand. And then they still, culturally, you have to shake hands. It's a huge respect thing. You shake someone's hands, it's acknowledgement and it's respect for that person. So it's like against their culture it's rude if you don't shake their hands. It's almost like, wow, I have a problem with you. I have a serious problem. I'm not going to shake your hand. So that's extremely uncomfortable for them to not do that. And, the lack of hand sanitizer at the same time. My grandmother, my aunt said this in one of their videos on live, that if my grandmother was alive, she would have gotten sick, because there's no way that you're going to tell her she couldn't help people. There's no way that you were going to tell her that she couldn't allow anyone into her home. Because she's like, no, if they need help, they need food, they can come in. So that's another thing that the elderly, it's a culture thing. Come in if you're hungry, come sit down, come eat. And now you add in everything else with the drinking water and the shared buckets, the shared hand washing stations, and then there you go. The things in our culture that brought us really close together are also the things that helped with spread it more. I think I just want to touch on, I live in a border town, and the mayor here, it's a tourist town, and we compare it to the movie Jaws, where they didn't want to shut down the beach and then more people got killed. It's the same thing here.
Yeah.
So the Navajo Nation has curfews, and they've done a lot of lockdowns, and you have to wear your mask when you go to a store on the Navajo Nation. The Navajo Nation is really strict right now, but the border towns are not. And okay. Our Arizona governor is in denial of the numbers, and the mayor is in denial. The mayor page actually blocked me on Facebook. Yeah, I'm like, I was not I only tagged you in a few things. I was not messaging and harassing. It was just I was hoping maybe it would be nice if he wanted to address these issues. But I think him blocking me made it clear that he doesn't care. And he did make a comment early into the pandemic, because he wanted us to open up the Navajo side to Lake Powell. He messaged the Navajo president asking to open Antelope Point Marina, and it was on the community page Facebook group, and a lot of Navajos were upset. Our people are dying. I think opening up the lake is the last thing we're worried about. Yeah. So it wasn't well received by the Navajo people. And then someone commented on that letter that was posted that the Navajo Nation president is busy fighting COVID, to get back to you about this letter. And then the mayor had commented, I wish that he would fight alcoholism as hard as he's fighting COVID. Wow. And then he posted a picture of some Navajos that were in Page. And it was just why, if those people are alcoholics, one, they're in your town, why does the Navajo Nation have to focus on those people? Is it because they're Navajo? Are you saying that alcoholism in Navajo is the racial stereotype, so that's what he said.
Wow. We're just and he's a mayor. He's the mayor of Page.
has to be like 50% Navajo or more. I know the school is like 80% Navajo. The schools, their students, they travel like an hour away to go to school here.
Yeah.
So most of your town is Navajo, and you make money off of our culture. So it was just like, it just shows what we're dealing with here. And even, you know, people in this town are trying to tell them, like, you know, we shouldn't open up the state. That we're trying to tell the governor not to open up the state, but it didn't matter. They opened up the businesses anyway, and now Arizona is the #1 state for the most increases, you know, within the last week or so. So it's like, we told you guys, but you guys don't want to listen. You know, it's bad over here. But I do believe it's going down on the Navajo Nation. I think the Navajo Nation is okay because we are getting them hand sanitizer. Every time we give someone a box, we give them hand sanitizers. We have masks. We take it seriously. Some, you know, I've heard from the healthcare workers here in Page that if they truly believed that if the Navajo president didn't take the measures that he did, it would be a lot worse for them. Mm-hmm. Getting food assistance, you used to be able to apply for emergency food assistance in a day and get it. But due to COVID, their offices are not open, and people cannot go in person and receive that type of help anymore. So everything is online on websites, and you have to think about these Navajo people now have to learn how to navigate websites, you know. So I have to help my parents with a lot of those things because, you know, like her mom didn't go to school; they just got high school. So it's like it's up to me, because before they would have like a person there that could speak to them in Navajo and help them with their papers and file everything. Now you can't because of COVID. So that's also an issue. I felt like if the restaurant was going to open, you're going to take people off of unemployment. And then, and just because of the steps the mayor and the governor are not taking, there's a high chance that you're going to get shut down, and those people are going to have to reapply.
Exactly.
And now it's even harder to get that assistance. And, you know, I don't know if you followed what happened with the small business loans. A lot of these restaurants are struggling because, you know, Trump's businesses, they got a lot of that money first before the small businesses. A lot of the people on the reservations, they made money because they would sell Navajo jewelry on the side of the road to tourists. So some of them, that was their income. They made a lot of money, but they didn't have, you know, a W-2. They're unable to get unemployment. So now all Navajo business is shut down. So they can't make any money. They don't have Wi-Fi out there. They don't have electricity. So how are they going to apply for things? They don't know. And that's why this is really important. So Tasmania is right next to Australia. So it's about the same size as that island down there. Because I was talking to someone in Australia. And then we have just a handful of hospitals. I mean, it doesn't even have a clinic or a hospital. You have to drive 45 minutes to a hospital. And a lot of people, with the lack of grocery stores, they have to travel to the border town because of all the federal red tape and lack of infrastructure. There are no Walmarts on the Navajo reservation. There's only a few small gas station type of grocery stores. So they travel to Page. They traveled off the reservation. They travel an hour or 2 hours just to stock up to stay home. So the lack of grocery store doesn't help you stay home and stay safe.
No,
you know,
it doesn't.
It doesn't contain the virus to this town because we have to drive out of town.
Right.
There's multiple issues. I think Trump wanted to, you know, give Indian Health Services less money the past year. They just want to take more things away from us, from a community that's already struggling with so much. Like, it's one thing on top of another. But since the Indian Health Services, the lack of funding, and it is free, they they have to work on preventive measures. So that's what I've noticed when I take my kids in. They said, this is what's going around. Here's what you can do to prevent it, because we don't have all the money in the world to give you what you need, because it is free. So that's one thing the Indian Health Services I really liked was preventive care. I feel like, regular doctors, you come in and they're like, oh, here's your pills. You're going to pay me and I'm going to get money. It's a profit thing for them. So we do have hospitals, but I feel like that might be an issue to look into more of how that affected the reservation. My concern was on the reservation, if someone gets sick, they have to be rushed very far. Some people that have been sick, they didn't notice how low their oxygen in their blood was. I think they head in when it's a little bit too late and it's a lot harder instead of sooner. After that first distribution with my parents to Botaway, we came back, and my sister that lives with them, she's a nurse, and she got sick with COVID.
Oh.
And she stayed with my parents. So then it was like, maybe you shouldn't come up here anymore. That's when they said, we got to be careful because your sister is starting to feel sick. But she wasn't positive yet. She didn't get a test yet. And then she was admitted to the hospital here in Page for a few days. And then that's when my stepmom started to feel sick too. So my sister was, she was in ICU for a few days, but she's a nurse here. So it was a little bit easier knowing that the people taking care of her had been her friends for many years. They're really going to take care of her. So
how is she doing now? She ended up in the ICU. That must have been quite scary though.
Yeah, that's, they got sick very early on, within the first month of COVID. I think you can't, I guess with Navajo traditions, you don't think about things because you don't want them to happen. You don't kind of jinx yourself. You just think about the fact is that she's there and they're helping her.
Right.
So that's all you can focus on. And now you focus on what else can you do for the community? What is something to keep busy? Because you don't want, the bad thoughts are not healthy. So we just waited it out, and then soon she was out of the hospital. But my stepmom, she went into the hospital and they didn't test her. She didn't meet the criteria to be tested early on. And that was due to the lack of testing. They wouldn't test people until they were admitted into the hospital, until they needed a ventilator or something. So the second time she went in, that's when they tested her, when she got worse. All the hospitals could do was treat someone as if they had COVID, just because of the lack of testing. So that's how it was early on. And that was crazy, I think, for America in general, that you don't know the true numbers. But eventually, I think they have some testing sites here in Page. I know Navajo Mountain had some, but you had to drive an hour. Yeah, after my stepmom got sick, and she got better at home. But while they were quarantined, me being a chef, I know about nutrition. I know food. So I was dropping off Pedialyte, fruits, ginger, spices, you guys have to have turmeric with it. You guys need these vitamins and minerals to fight. It's not just vitamin C. You need everything, all your organs. I was like, you guys need to eat this. And so, my stepmom, she recovered at home. It was difficult, but, she had an oxygen tank. And then, my dad started to get sick. But he's dad. He's a tough one, I'm still fine. I'm gonna go do this, but then he's tired. I was like, no, you're so as soon as we could get him admitted, he was admitted just because of his age. He's gonna be 62, I think, this year. So because of his age, we're like, no, your butt's going to the hospital today. We need you there. We need you to sit in there. And if there's anything, they're right there. He was in the hospital for over a week. So it's both my parents, my sister, and then they have 3 other people that live with them, my brother, and then my other sister. She's a senior. She lost her taste and smell. And then my cousin and my brother, they just kind of got like sick for a day or two, and they were fine because they were younger, like 21 and 19. So, and then the youngest one, my youngest sister, she's now 12. She had no symptoms. But I think being, in the restaurant industry, and you have to always be conscious of not getting anyone sick,
Right.
Taking those measures and washing your hands. You have to wash your hands before you eat and all this stuff. Like it's I've been doing that my whole career. So I feel like that's really has helped me, be safe. But I do need to get tested just in I guess in general, just to know. But my kids, like, they didn't leave the house for like ever. I was, no, you guys are dangerous to other people because you might not have any symptoms.
Exactly.
So yeah, they stayed home. Sometimes we go out to the reservation alone, out to Botaway and do our own thing once in a while. So dealing with my whole family being sick, even the week that my dad was in the hospital, you're just like, okay, he's eating, he's just joking around, so he's fine. But you just push away that, the bad, dark feelings. That's not going to help. I think for me, if people are sick, you have to have their mind happy too, because the worry, the stress, it could weaken them. If their spirit's strong, it's going to help their body. So it's like making jokes, that was me. I couldn't be the one who's draining their spirit.
Yeah. So
let me joke around. Let me just, my family wasn't freaking out, but if I just noticed something, be like, look, this is the facts, he's fine. We had to kind of just keep each other like, okay, now he's coming home. I think the day that I found out that he was at home, I was just like so happy.
Yeah. Must have been a huge relief. Yeah. Mm-hmm. Just to keep those spirits uplifted, and positivity goes a long way.
Yeah. I mean, he still gets winded, like after walking around or helping, he'll start breathing hard. For my stepmom, she's saying that it's like it affects your body. It's so strange. It throws your body off that you start having these weird issues that you didn't have. With the female clock, the females that got COVID, even though they weren't, like my senior sister wasn't, that sick, it threw off their clock,
Okay.
It threw off their body, and they said it's really weird. Our body's not the same. It'll be interesting to see the effects of it long term.
It will be. Yeah, very interesting to see the long-term effects, because we just don't know what those will be.
So I lost a friend that I went to high school with. He passed away from COVID along with his dad and his grandfather.
Wow.
So that was 3 generations of men. He left behind a son, and his ex remarried, but she told me her son struggles with losing his father, his grandpa, and his great grandfather. It's been it was. We lost a nurse at Page Hospital here to COVID, and then it's just like it just got to, I just can't, let me just focus on relief.
Yeah.
It's like, it's too much. I had a friend who passed away, but I don't know if it was COVID. I heard she went to sleep and she didn't wake up. She's 2 years younger than me. So, her family's grieving right now, and I feel like respect is huge. So it's none of my business. My family lost 3 family members. So my dad lost his aunt, her husband, and their adult daughter. Their adult daughter had Down syndrome. So all three of them passed away in less than 2 weeks. So.
Wow, I'm so sorry to hear that. That's terrible.
Yeah, it was, I think, but for us, there was, great relief with the fact that they left together, and it was quickly, because those three were like always connected. They were always together. Someone with Down syndrome is like one of the best people in the world, so it was hard, but it was quick, and they were together. She had to be in her 80s, my dad's aunt and her husband, and my aunt Sharon was like 45, I believe. So, but Sharon and her mom passed away on the same day, and then the dad passed away like a week prior. So, it was just, it was difficult, but they were getting older. So if they would have passed away and Sharon was left by herself,
that would have been difficult. Yeah. The death toll and the numbers of people dying, every day, but really living in a smaller community and having those connections with people and, knowing your neighbors and knowing all of these people, it really puts things into perspective. I mean, you're listing off so many, lives that have been claimed from this. And we just hear, living in big cities, you hear about, just the numbers, and you may not know people who have been directly affected.
And then it's just like, I can't keep up. I also can't mentally carry that weight. You kind of get like shell shocked, I guess, where you just like, okay, if someone else goes, and someone else goes, but it becomes like a war zone mentality.
Yeah. And how are you coping and dealing with that?
I'm trying to think. I think it was a lot harder back then, but I think we as we go along, I'm not sure. I just feel like it just kind of, the time goes by. There's so much more things to do. When my friend, when they had her funeral, you can't gather anymore.
Right.
Then I think that was also something for me to be aware of. Like, how are we coping? I don't know. Because when someone passes away, we bury them on the 4th day. So all the days prior, we gather at the family's home. We have meetings. We discuss what happened. We grieve together. That's very therapeutic to come together. You grieve with the family. You take care of the family to help them, I guess, kind of like process their grief. Yeah. And they have so much community support daily since the loss happened. My cousins, when we had her funeral, my dad's, because all your uncles are considered your dads. All the males in your family are considered like your brothers. So my dads and my brothers, they dug her grave. It's very personal, and we can't do that. I can't hang out with my friends because I can't risk anything, especially if I'm there for the community. I can't risk hanging out with anybody. So, I have to go over there later on by myself. So you go there alone, and it sucks, but I think you just accept this is what it is. This is what keeps people safe. They're all in a better place, and the body was just temporary. I think that's a good thing. You put them away and you leave them alone. It's kind of our culture, because you don't want to hold on to things that keep their spirit here, and then their spirit gets sick or happy. They really deserve to be let go and happy. Like, we'll see them later. So that grief is just because we're inside this body.
Just to have that sort of network and support physically, I guess, is not there. So how has that been?
Probably, I feel like it's probably what I'm used to prior, like the boarding school. You didn't have anybody, but I feel like I completely understand, my mentality, because I know where I am mentally, and I know when the time is there to process, I have to be aware, and I'm aware, I guess. That's the main thing. I'm aware of what I'm holding in, and until there's a safe place for that, I just have to be patient with it and be patient with myself and that grief. I feel like in the beginning when my parents got sick, and it was just like, it was driving me crazy being locked down in here. I know I have friends who are introverts, and I'm just like, help me. Like, I need people. My love language is touch. I don't know if you know about the 5 love languages. So my love language is touch. So if I have going to work and I have a tough day, I have the great friends there, and I would say, you know what, I just need a hug. So I would get a good hug from someone. I'm like, I feel great. Like, my day is awesome. So then it was just like, it was a struggle, and I'm just like, okay, this sucks. But the next best thing is quality time, and you know, touch is also being in their physical presence. And I feel like that's what's really has helped me, is when we distribute, we still, you know, you can't hug them, but I could see them. It's in person. I could talk to them. Before, my feelings of wanting to get a hug or shake someone's hand, we have developed this anxiety of like, we see someone and we're like, are you 6 feet away?
Yeah.
Do I have my mask on? Did you wash your hands? I feel like we developed that anxiety first.
Yeah, exactly. That's taking over all of those interactions. Yeah.
Yeah. I have some good friends that check on me, but I feel like my mentality just goes into like robot mode because I have to get to work. I feel like sometimes I do let it out. I do like cry for my friend, especially for her. This is not the first pandemic our people have gone through.
Mm-hmm.
You know, people have gone through the long walk. They've gone through a lot of things. Like, every generation has gone through things. So I think being inspired by the resilience in the tribe, the Navajo people in general, that's inspiring. And I think that keeps me feeling proud and happy for all of us. I think when I see other people stand up and do something, like Zolzani, he's doing the Water Warriors, and that's growing. That's inspiring. I think all my whole family has come together amazing. Yeah, all my extended family. I have a cousin in LA who's raising money for us. I have an aunt in Phoenix who's doing the website for the Water Warriors. My aunts have more things coming up. Just the Martin family in general has always been a well-respected name in that Botaway area. So to have my grandma's legacy, my grandfather's legacy, to be there for the people, that's just like the most beautiful part of it. We really want to empower the people. We don't want them to be dependent on us. So it's like, what can we give you where, you know, you're gonna do better, like solar. We don't want you dependent waiting for the government. What can we do where it's not us being like the government that has power over you? It's like, let's give you whatever power you need. So I think that's been really inspiring, and that's just the amazing part of it. I think the people that really stand there and are looking out for one another.
That's tremendous. I mean, you're first and foremost your inspiration, your grandmother, and to see how you're part of a family who really wanted to empower others, which couldn't be more important during this time. You've touched on so many issues, but really, what are sort of the core things that you want people to know, be aware of?
Just due to our loss, our great loss of people, show some respect and acknowledge that COVID is real, and to be appreciative of the fact that it hasn't touched them in the way that it's touched us. I feel like if they could acknowledge that it's real, if they could appreciate that they've been safe, that would mean a lot, because what we've gone through is terrible. in a way, we are very appreciative that people that they don't feel this, you know, they don't know how bad it is because it hasn't touched them like this, and that's good. But, you know, just take it seriously. There's a reason why Native people and the Black people are really upset right now, is because of all these injustices and how it has affected people of color. If you see in New York, the people that were dying were from the poorer areas. Research the people you're voting for. It doesn't matter if they're red or blue, just research them, because these are the people that will be deciding whether or not we have a stimulus check that help us stay home.
How can we help? What can we do to support Navajo Nation out there?
We have our GoFundMe. I know there's some struggles within the Navajo Nation about the CARES Act. It's very, you know, we had to file a lawsuit to even get that released. So, and Indian country was left out of that relief package in the first place. So, like, and it came with a lot of red tape, and our Navajo government is still trying to figure that out. But there are a lot of grassroots relief efforts throughout the Navajo Nation. There is ours. They can follow me on Instagram, amartin2727. There are the Water Warriors United, which is, you know, Zoe's doing amazing things with the water. We really appreciate just doing their own research, because I forgot what someone said. It's very draining to have to constantly, people reach out. What do I need to do? What do I need to learn?
Yeah.
You just follow people. It takes an emotional toll. This conversation is different, but, you know, I experienced it on Facebook. It's like in the middle of your grief, someone's like, can you tell me why it hurts so much and stuff like that, and how, you know, you're just like, let me just be, you know, let me hold on, like, can you just research, can you look it up right now? Like, we're dealing with a lot. Just there's a lot of research. I think I want them to be patient too as they're learning about the Navajo Nation. They should just, it's just like, you know, just jump in, just start helping, and you will learn. As time goes by, you will learn, you will start seeing things, you will, you know, it takes time to learn what's going on. Once they start following people, and once they start following Navajo social media stuff, you know, start understanding things. I feel like there is a disconnect with some of the white people in Page, because a lot of them don't take COVID seriously, and that's because maybe they don't have Navajo friends. Maybe, so they're not hearing about the deaths. They're not being and they're right here in the same town. So that I was, you know, discussing with one of my, a friend of mine, you know, we became friends closer throughout this, because she wanted to learn more about, you know, what's going on the Navajo Nation, like what's going on. So then I tell her, this person passed away, this person passed away. And she's like, we're not hearing about this in Page. And it's kind of like, why would you? Your mayor is not even acknowledging or sending condolences to the Navajo Nation. So there is a lack of unity between the people. So I think that's what people have to be aware of. Who are they following on social media? Are they following Navajo people? Do they have a blend of people? You know, that way, if you want all lives to matter, then you will care about all lives. You know, it won't just be, you know, your social media followers won't just be whitewashed. So I think they should take that step back and make sure they are including everyone. The one thing with our relief, it's like, so we just got a bunch of food from Compassionate Colorado. We got medicine, we got toilet paper, we got hygiene products, you know, adult diapers, and so much. It's like other communities are now like, hey, can we have some of that? And it's hard. It's hard because we're not going to say no, but the need is so great. There are many communities that they're not getting the attention they need. There is a great need. if the more stuff we get, the more we can share.